Good morning and welcome to Mental Health Advocacy Day. My name is Lori Emerson and I feel privileged to serve as the Executive Director of the National Alliance on Mental Illness of Vermont. I want to thank our partners and co-sponsors who helped to bring all of you here today, both in person and live stream. Every year we keep coming back to the State House for Mental Health Advocacy Day as a united coalition of advocates and organizations. It takes hard work and many years of advocating to make a difference. And I'm proud of the work we've done and that we're going to continue to keep doing. Our theme, Together for Dignity, United for Change, Reclaiming Mental Health in Vermont, reminds us that dignity is a human right. Yet mental health challenges along with stigma, isolation, limited access to care can make that dignity feel out of reach. Reclaiming it means creating communities that are grounded in respect, compassion, and understanding. Everyone has mental health, and it's our shared responsibility to create environments where people feel safe to speak up, seek help, and receive the right care at the right time. Our rural state faces significant challenges: limited funding, fewer services, transportation barriers, and persistent provider shortages. To create real and lasting solutions, we must be inclusive and ensure that the voices of our communities guide the way. Our advocacy efforts keep reminding us that a mental health crisis deserves a mental health response, and Vermont has made meaningful progress with 988, mobile crisis teams, and mental health urgent care facilities. Still, there is more work ahead. Local organizations, peer support networks, and community-based programs play a vital role in the mental health system of care. They offer connection, understanding, and hope. When we come together with a shared commitment to change, we strengthen those supports, expand access to care, and improve crisis response. And we reduce stigma. Collaboration is essential, and we must continue joining forces to find solutions that truly serve our communities. And the work we do at NAMI Vermont is grounded in 3 pillars. As our mission, we do education, support, and advocacy. These efforts are carried out by our dedicated volunteers and staff, whose commitment to individuals, families, and the broader community makes our work possible. And I'm deeply grateful for their ongoing service. We are thrilled to introduce a new initiative during the legislative session: Uplifting Youth Voices to Advocate for Mental Health Policy Reform. This project is designed to equip high school and college students with the skills and support to become the next generation of mental health advocates. This effort strengthens youth influence in public policy by engaging young people directly in identifying and speaking about the mental health issues that matter most to them. We're seeking young people to join our youth mental health advocacy cohort, where they'll receive advocacy training, practice sharing testimony, meet with legislators, and receive ongoing coaching and mentorship. We are seeking adults who will represent the younger children as well. We're partnering with youth-serving organizations to ensure a safe and inclusive environment where young people can elevate their priorities and help shape mental health policy here in Vermont. If you're interested in participating as a youth advocate, a legislator, a partnering organization, or a representative for younger children, please reach out to me. We'd love to have you involved. So let us continue to keep normalizing the conversation about mental health. Together, we can build a Vermont where every person feels valued, supported, and understood. And now I'd like to turn it over to Daniel Franklin, the Executive Director at the Vermont Association of Mental Health and Addiction Recovery.
Thank you, Laurie. As Laurie mentioned, I'm Daniel Franklin. I'm the director of the Vermont Association for Mental Health and Addiction Recovery. Welcome to the 11th Annual Mental Health Advocacy Day. I do just want to express a few words of special thanks to my colleagues who helped plan this day, and Amy Johnson and Amy Rose from Vermont Care Partners, Martina Anderson from VAMHAR, and our fearless leader for all these years, the amazing Laurie Emerson. Please. Thank you to all of you for being here, both in person and online from throughout Vermont and beyond, to be together and standing up for our dignity and the dignity of everyone we serve and love who deserve our unconditional care and support. Only through our unity and strength of numbers and our voices can we truly reclaim the kind of care that we deserve together, and regardless of our struggles or our backgrounds. Today is not just about what is said to you, it is about what you say by being here and participating in advocacy in all of its forms, in this room and under the Golden Dome and in every community throughout Vermont. Every life matters and every voice matters. Thank you to all of our co-sponsors and our remarkable partner organizations whose support made this event possible. Thank you to our artists who shared their art for our slideshow this morning, and we appreciate the Howard Center Art Collective who helped to get the word out. We're honored and thankful to have our ASL interpreters, Sierra Mangum and Lisa Kingsman. So from Bankrow, thank you so much for being here. We're thrilled to share an inspiring agenda with you. We'll begin with our state leader welcome with the Commissioner of the Department of Mental Health, Emily Hawes, and the Secretary of Human Services, Jenny Samuelson. We're honored to have you here, as well as remarks from our congressional delegation. Then will be followed by a keynote presentation by two very special people and true allies of ours, Representative Daisy Rebecco and State Treasurer Mike Pichak. From there, we'll hear from some beautiful, courageous colleagues who will share their stories. We'll celebrate our award recipients who you helped select, and we'll have a special surprise, so please do stick around, wait all the way to the end. And finally, we'll hear from Amy about advocacy, and we'll grab lunch and meet with legislators for our policy table talks. Testimony has been scheduled throughout the day at the State House. After lunch, please join us at the card room near the cafeteria and House chamber to network with legislators and other guests. And finally, the House of Representatives will recognize us on the floor with a tripartisan resolution around 3:30, if you can join us in the balcony for that. This event is being live-streamed and recorded by Orca Media. Thank you to our partners at Orca Media who have been with us for so long, making this available and accessible widely during the show and after the show. And it will be accessible via the NAMI Vermont website later on. If you need support during this event, please don't hesitate to reach out to any of our colleagues back at the tables, at the NAMI Vermont tables. There are also lots of resources, including some text lines and 988 and other types of support services. At the end of the event, an evaluation link will be displayed on the screen. We ask you to take a minute to share your feedback with us, and we'll email everyone a link to the survey later. And with that, I'd like to turn it over to my colleague, Amy Johnson from Vermont Care Partners.
You're going to hear from me a lot today, maybe too much, but that's okay. I'm here for it. Good morning, everyone. I'm Amy Johnson, the Director of Legislative Affairs and Public Policy with Vermont Care Partners. I support mental health and substance use supports and services for people with intellectual and developmental disabilities. I'm your friendly advocate in the State House, sometimes not so friendly when I have to be, but I'm there and I represent you. I spend a lot of time next door. I sit in committee rooms, I listen to testimony, I track the budget and the policy choices that shape mental health care in Vermont. And I can tell you a lot of important decisions are made there every single day about people's lives, their care, and their dignity. It's critically important that those decisions are made with the voices of the people most affected fully in the room. So let me start by saying this loudly and clearly. Welcome to the People's House. It's next door, but pretend we're there. Close enough. This place belongs to you, not just to elected officials, not just to agencies, not just to advocates like me, but to Vermonters. And our democracy works best when the people who live this, who work in this, and who are impacted by it show up and claim their space. When I first started working at the State House, I set a goal for myself to do 3 hard things every single day. It was exactly what I needed to push myself to speak up, to ask uncomfortable questions, to have conversations I might otherwise avoid. Over time, those hard things didn't feel so hard anymore. Not because the work got easier, but because doing what's right stopped feeling scary. And those small, hard actions taken consistently ended up having real, lasting impacts for people across Vermont. That's a reminder I come back to often. Change doesn't come from grand gestures alone. It comes from showing up and doing the hard things again and again. Especially right now, at a time when the world feels heavy, when federal uncertainty is real, and when so many people are carrying fear, grief, and exhaustion, it can be easy to feel powerless. But here in Vermont, we have something incredibly important: proximity and access. The ability to show up and say, this matters and here's why. Mental health care matters. Mental health care is not a side issue. It is not a secondary care. It is not something we talk about only when there's a crisis, a headline, or a public safety concern. It is health care, full stop. And it is a critical part of the system of care that keeps our communities functioning, our families intact, and our people alive. And yet, mental health remains one of the most stigmatized areas of healthcare we have. People living with mental health needs are too often blamed, feared, or treated as problems to be managed rather than people to be supported. Workers in the system are stretched thin, under-resourced, and asked to hold together care with goodwill and grit instead of real investment. We talk endlessly about the need for services, but far too often the funding and policy choices don't match the rhetoric. And here's a truth I want to say again: mental health matters. We cannot cut, constrain, or sideline mental health care and then act surprised when systems fail and people fall through the cracks. And we cannot keep making decisions about communities without listening to them. That's why today matters. Today is about reclaiming mental health, not as a talking point, but as a shared responsibility and a shared priority. Dignity is not something the system gives people when it feels generous. It is something every person already has and something our systems are obligated to respect. Dignity means having a voice in decisions that shape your life and your care. It means being heard before policies are written, budgets are finalized, and consequences land. Nothing about us without us. Care that honors dignity means care that meets people where they are and treats them like the full human beings they are. Care delivered in the right place, at the right time, at the right level, not because it's cheaper or easier, but because it's right. And dignity also means voice. It means refusing to stay quiet while decisions are made that shape your care, your work, and your lives. It means showing up here in this building next door and reminding folks that mental health belongs to the people, not just the system. Advocacy doesn't have to be fancy. It doesn't require knowing every acronym or bill number. I certainly don't know them all. It starts with telling the truth clearly, calmly, and persistently to the people making decisions. Today is about amplifying your voice, about reminding policymakers that your experience is expertise, and about making it unmistakably clear that mental health policy and funding should be shaped by the people who depend on it and deliver it, not just debate it in theory. So take up space today, ask questions, share your stories, make it personal, because it is personal. This is how change happens in Vermont. People showing up together saying we care too much to let this be an afterthought anymore. This is the people's house over there. You belong here, your voice matters, and together, with dignity, with urgency, and with resolve, we are claiming mental health in Vermont. All right, I'm gonna keep talking. Like I said, I'm up here a lot. So I have the honor of introducing our state and federal guests. And so I have written some bios. When people don't provide me with their bios, they let me take creative liberties. Don't worry, they're okay. So we're going to start with Secretary Jenny Samuelson, who's the Secretary of the Agency of Human Services. Secretary Jenny Samuelson brings deep experience in healthcare policy, payment reform, and public health to her role leading the Agency of Human Services, where she has served for approximately 3 years? 4 years. Again, okay. Prior to her appointment, she held senior leadership roles at the Department of Vermont Health Access and was a founding leader of the Vermont Blueprint for Health, helping shape major healthcare reforms, including patient-centered medical homes, community health teams, and the hub and spoke system of care. As secretary, she oversees Vermont's human services agencies with a focus on aligning programs, managing system-wide pressures, and ensuring essential services remain accessible and sustainable for Vermonters. So, Secretary, please come up.
Thank you, Amy. Next time we'll provide bios, but I think you actually did a better job than we did. And 4 years, it like oftentimes feels like 10, but many days, on days like today where we're shaping policy, it feels like it's been the blink of an eye. It's difficult to change systems over time. So good morning, everyone. Thank you for including me today. It's truly meaningful to be in a room with such a broad, diverse, and deeply passionate group of advocates, providers, policymakers, and people with lived experience, all coming together to add your voices to the conversation about mental health in Vermont. As Amy said, we're unique, having worked in several states, that we have such access and collaboration here in the state, and your voices really do matter. As Amy said, I'm Jenny Samuelson, the Secretary of the Agency of Human Services, and it's an honor to be with you this year at this year's 11th Annual Mental Health Advocacy Day. I'm grateful for the opportunity to gather for a day that centers dignity, community, and action. And specifically for me, it's the action. This year's theme, Together for Dignity, United for Change, Reclaiming Mental Health in Vermont, speaks directly to the moment that we're in. Mental health is not separate from the rest of our lives, and it is a part of all of our lives. It's about how we treat one another, how we design systems, and how we show up when people need support. Reclaiming mental health means reclaiming the idea that every person deserves care that is humane, accessible, and rooted in respect. It's in a time marked with uncertainty and events unfolding across our nation and world, it's more important than ever that we care for one another. I want to thank NAMI, Vermont Healthcare Partners, the Vermont Association for Mental Health and Addiction Recovery for your leadership and partnership. You have helped create and sustain a space that brings together advocates, providers, policymakers, and people with lived experience year after year. That community and that continuity really matters. It is how trust is built, and how momentum becomes lasting change. I also want to acknowledge something many of us are aware of, even if we don't name it. While Vermont continues to model collaboration, shared purpose, the broader national climate can find its way into our work and into our conversations. At times, that can make it a little harder to stay grounded, connected, and focused on what we're trying to accomplish together. That is why this space matters so much. It's an opportunity to hear each other's voice. When we take the time to listen, remain curious about one another's perspectives, and stay centered on our shared goals, we strengthen the trust that makes real progress possible. What matters is our willingness to stay engaged, to seek understanding, and to keep working together to serve the people and communities that we care about most. 11 years ago, conversations about mental health were quieter, more limited, stigmatized. Today, this room tells us a very different story. We're speaking openly across sectors and cross experiences, and we can't slide back. At the Agency of Human Services and across state government, we're working to build a mental health system that reflects dignity in practice, not just in principle. We see this in the growth of mobile crisis, in the continuity and expansion of mental health urgent cares. We see it in the 988 suicide hotline. We also see progress in expanding access to mental health and substance use disorder in our correctional facilities and the opportunity for more comprehensive care through the CCBHCs. But as it's been said, it's not enough. I'm excited to see this work continue and to see the program strengthen, but I'm also excited about the opportunity to continue to advance this work, things like building a stronger workforce, making sure that where you live doesn't determine where the care you get in the services that we've advanced over the last couple of years. And we're able to do some of that work through the Rural Health Transformation Funds. And I look forward to working with the folks here in this room to really define what that looks like, because the best policy comes through collaboration. These are not abstract programs, and I want to be clear about that. They're often lifelines for people and for our communities. At the same time, reclaiming mental health also means being honest about what we are struggling with. Vermonters continue to face real and complex challenges, workforce shortages, housing instability, and ongoing uncertainty. Many of us in this room are carrying the weight of that every single day. It may be in different ways, but we all feel it. I want to thank you for showing up again and again, even when that work feels really heavy. Your commitment matters, and it is seen. Mental Health Advocacy Day reminds us that systems improve when people engage, when voices come together, and when dignity helps guide our decision-making. Thank you for your advocacy, thank you for your persistence, and thank you for the work you do every day to strengthen mental health in Vermont. I'm honored to stand with you, and I look forward to the conversations and actions that will come today and into the future.
Thank you, Secretary. Up next, we have the Commissioner of the Department of Mental Health, Emily Hawes. Commissioner Emily Hawes has led the Vermont Department of Mental Health for approximately 4 years, 4.5. Thank you. Time flies, and brings extensive experience across Vermont's community mental health system. She has served in multiple roles at DMH, including Care Manager, Director of Care Management, Director of Operations, and CEO of the Vermont Psychiatric Care Hospital. As Commissioner, her leadership has centered on strengthening the crisis continuum and supporting a system where Vermonters can access the right care in the right place at the right time, which is very important. So, Emily.
I thought it was going to be a little more creative than that, so I was sort of prepared to. Earlier, when Amy and I were talking in the coat room, somebody was landing a rocket ship on the moon or something like that. So, anyway, thank you all for having me here today. It's an honor to stand in front of you all. Wow. I just looked at the pictures. So one thing I'd like to highlight is about 11 years ago, I stood at the top of the People's House over there and took a picture of a snowy yard out here at the front of the State House that was filled with advocates on Mental Health Advocacy Day. with signs and singing and speeches, and it was before my time here at the state of Vermont as a staff member. I was actually working at the Clara Martin Center in Randolph, Vermont. Yay, Clara Martin Center. But I had that opportunity because the leadership at that agency supported bringing leaders, and I see several leaders from the designated agency here today to interact and take in what it means to be a part of a Mental Health Advocacy Day. So I'll have to share that picture. It's really cool if folks don't have it. Anyway, I rambled and went off my script, which is not uncommon, but I'll stick to what's been prepared for me as well. So, like I said, good morning, Emily Haas, Commissioner for the Department of Mental Health. I'd also like to give a special thank you to the hosts of this important event. Thank you to the National Alliance on Mental Illness of Vermont, more commonly known as NAMI, Vermont Care Partners, and the Vermont Association for Mental Health and Addiction Recovery. I don't know where you went. There you are. Who are all leaders in uniting mental health efforts throughout our communities in Vermont. We all know, or else we wouldn't be here, that mental health requires awareness. And awareness is a powerful tool. It helps spark positive change, and it unites us as a community in supporting one another. We have done a lot of work to raise awareness and to reduce the stigma surrounding mental health. We have expanded access to support, and through awareness, we have created spaces where people can have the courage to reach out for that support. Just this year alone, we've come close to hitting our goal of answering 90% of 988 calls within the state. Vermont per capita is one of the highest utilizers in the nation of 988. And that is because of the advocacy work that Vermonters have done to make sure that our community members know 988 and can call that. And then also the agencies who are picking up the phone, NCSS and Northeast Kingdom Human Services. So thank you. Mental health challenges impact roughly 1 in 5 Vermonters each year, but the impact goes far beyond those who directly experience them. Mental health is not just an individual issue. It touches friends, families, colleagues, loved ones, and even the strangers that we are encountering every day. Every person in Vermont either experiences mental health challenges, is closely connected to someone who does, or will interact with someone who does at some point in their day. So mental health is therefore a community issue for us to talk about and think about. Awareness is also just as important for those who support loved ones as it is for the individuals experiencing challenges themselves. And awareness also matters for all community members who may interact, sometimes unknowingly, with someone who may be having a difficult time. And this is why events like today are so meaningful. They give us a chance to pause and remember to treat those around us with compassion and empathy, because you never know the struggles that someone is carrying. And it makes us all a united community. The community must also unite in support of individuals with a mental health condition. Compassion gives folks with a mental health condition dignity in their daily lives. Support gives folks with a mental health condition dignity as they manage what seems ordinary to many. And awareness is a start, and through unity, positive change can happen. Being united in the community helps professional caregivers secure funding, receive training, perform research, reach individuals in need. A united community creates a safe place for folks with a mental health condition to feel accepted and thrive. And a united community brings positive change, and positive change will help Vermont reclaim mental health. So I'd like to thank you for having me here today. It's wonderful to see the turnout and continuing to see this turnout grow every year. And at some point, when it's not negative 180 degrees, we can be outside on the people's lawn with signs, doing the fun stuff out there that really gets people energized. So thank you for having me today, and I look forward to hearing the personal stories and from the other leaders in the state.
Okay, we're going to move into our federal delegation leadership. None of these folks are here today, so feel free to reach out to them and say, I think I know you're in the state of Vermont. Why weren't you at Mental Health Advocacy Day? And I'm telling you it's okay to say that. So we have a couple of videos which hopefully somebody from the team will help with, because I have no idea how to do that. We will hear shortly from Senator Peter Welch, who has sent video remarks. We will also have video remarks from Congresswoman Becca Ballin. But first, and hopefully they are here, Maggie Burke, are you here? Yay, so awesome. So Maggie is here from Senator Sanders' office, and she's going to be reading some remarks from Senator Sanders. So Maggie?
Good morning. It's an honor to be here on behalf of Senator Sanders. He actually is in D.C. this morning, I promise. He would love to be here. There is a lot going on right now in D.C. I'm an outreach representative for Senator Sanders. I cover the issue areas of healthcare, veterans, seniors, disabilities, first responders, and recreation, just a couple. I travel around the state and get to be Senator Sanders' eyes, ears, and often his voice. If you haven't met me before, it's because I'm relatively new to the office and drinking from a fire hose as I learn to navigate all of the different things that are going on here in the state. But I'm really, really grateful for all of you and for all of the work that you do. In my free time, I have a weird hobby of being a paramedic. So I see firsthand in the evenings sitting there with a patient who may be needing to access mental health care. And you all, those of you that are doing the work, are heroes in this state. So thank you for that. I'm going to read this letter from Senator Sanders. I'm not great at my Bernie impression, so please just use your imagination of what his voice would sound like and the hand movements as I read it. So, dear friends, thank you for gathering to advocate for a strong and fair mental health care system in Vermont. Let me be clear. Mental health care is health care. Mental health is a central component of overall well-being. It is imperative that the many people who cope daily with some type of mental health condition have access to the care they need. Unfortunately, I hear all too often from Vermonters who struggle to access and afford mental health care. In the wealthiest country in the history of the world, we must guarantee health care as a human right. We all know that insurance coverage for behavioral health and mental health care services often lags behind coverage for physical health care services. When people are in crisis, they need help today. They should not be put on a waiting list to be seen months from now. That is why I introduced the Medicare for All Act in the last 5 sessions of Congress. Under this legislation, every resident of the United States would be guaranteed improved and comprehensive health benefits, including comprehensive mental health care. The need for increased mental health care is often more pronounced in rural areas and exacerbated by the shortage of mental health care professionals. I believe that we must encourage prospective mental health and behavioral health care providers to practice in rural and underserved areas through robust and continual investments in programs like the National Health Service Corps to provide scholarships and loan repayment for providers who commit to practicing in underserved areas. Here in Vermont, I'm proud of our local designated agencies and federally qualified health centers that provide quality and affordable behavioral and mental health care to everyone, regardless of ability to pay. These clinics are often the only source of health care in rural areas, and they do very important work, often with very limited resources. To my mind, Congress must be doing more to increase funding for vital mental health services. Unfortunately, last summer, Republicans in Congress and President Trump chose to instead make the largest cuts to Medicaid in American history in order to pay for $1 trillion in tax breaks to the top 1%. I will keep doing all I can to reverse these disastrous cuts and fight to expand mental health care to all Americans, no matter where they live and no matter their age, race, sexual orientation, or gender identity. Thank you again for all you do to improve healthcare in our state and help Vermonters get the care they need. Sincerely, Senator Bernie Sanders.
Thank you so much, Maggie, for being here. And I just want to say, and I think this is important, we have a pretty kick-ass federal delegation. We really do. And I will say, when we talk about proximity and access, though they're not always here, they're often in DC, they are accessible to all of us. I think many of us in the room have met with our senators and congresspeople directly, because when they're here, they want to meet with you directly, and when they're in DC and you go there, they'll make time for Vermonters, and especially mental health care. That's a priority area for all three of our delegates. So just want to say great appreciation, and in terms of advocacy, these are folks that are also accessible to you. So I'm stalling because now I see Lori is coming up to do the part that I don't know how to do, the videos from Senator Peter Welch and Congresswoman Becca Balint. Thanks.
Hi, everyone. Peter Welch. Together for Dignity, United for Change, reclaiming mental health in Vermont. The focus is on fighting the stigma that people with mental illness often face, and ensuring that we continue to work to improve the lives of Vermonters with mental illness. Dignity is the foundation of mental health. It means that being seen as a whole person and not as a diagnosis. It means being believed when you say that you're struggling. It means having access to care without having to explain yourself or have long waits or unnecessary barriers. But for too many Vermonters, dignity is still something they have to fight for. When we talk about reclaiming mental health, we're acknowledging something important. Mental health doesn't belong only to systems, to institutions, or policies. It belongs to people. It belongs to families, to neighbors, schools, workplaces, and communities. Reclaiming mental health means shifting from crisis response to prevention, from isolation to connection, from silence to shared responsibility. Across Vermont, people are working very hard to address stigma. Advocates, clinicians, educators, first responders, and families, and individuals with lived experience. What makes the difference is when we do it together. So as you meet today, let's commit to listening deeply, acting boldly, and staying connected beyond this room. Because reclaiming mental health in Vermont isn't the work of one organization or one moment. It's a shared movement. Thank you.
Hello, Vermont. I'm Congresswoman Becca Balint. Mental health care is health care, period. And supporting Vermonters' mental health is essential to strong families and healthy communities. On Mental Health Advocacy Day, I want to thank everyone who does this work every day. The providers, the advocates, caregivers, and neighbors who show up and help break down stigma. Ending stigma starts with talking honestly. Anxiety, depression, trauma, and stress are part of the human experience. No one should feel ashamed for needing help. I hear from Vermonters across our state about the mental health crisis. Not just doctors and nurses, but parents, teachers, students, and first responders, and also the employers who see the impact every day. We're in the middle of a national mental health crisis, and at the same time, the Trump administration has shown a willingness to slash healthcare and limit access. Here in Vermont, too many schools are reporting rising concerns about anxiety, depression, and trauma among young people. That's why we have to push back and expand access to mental health care, especially for young people. Over the past year, I've introduced legislation to confront this crisis, including the Transgender Healthcare Access Act and the Peer Education and Emergency Response for Mental Health Act. I've also called out harmful rhetoric from RFK Jr. that stigmatizes mental health treatment, because words matter. In Congress, I will keep fighting to expand access to care, securing funding for mental health services, and I will continue to challenge stigma wherever it exists. Everyone deserves affordable, comprehensive health care, including mental health care. If you or someone you know needs help with a federal agency, you can call my office. Just call us at 802-652-2450 or visit balance.house.gov/contact. Take care of yourselves, check in on your loved ones, and rest when you need to. Onward with courage.
Thank you so much. It took teamwork to get that to go. And now we are ready for the keynote presentation. So if you could come up.
I get to introduce you all to our keynote speakers today, but I probably will have a little bit of a preamble because I am known for this. My name is Martina Anderson. I get to work for the Vermont Association of Mental Health and Addiction Recovery, and I am so excited to be here today to welcome you to Mental Health Advocacy Day 2026. I want to start off by saying I'm so glad you are here, not just because you showed up, but thank you for showing up, but because you showed up for something that matters deeply. Mental health advocacy is not theoretical, it is not abstract, and it is certainly not something we only talk about when it is easy, convenient, or comfortable. Mental health advocacy is personal, it is lived, and it is urgent. And this year's theme captures this beautifully. Together for dignity, united for change, reclaiming mental health in Vermont. Reclaiming, that word holds so much. Because for too many people in our state, mental health has been treated like something to manage quietly, survive silently, or even apologize for. But today, we are saying no, not anymore. Again, I am taking a little while to get to the point, as per usual, but I promise this all matters, especially in the moment we are finding ourselves in right now. Because for many of us, this is not a neutral moment. It's a time of real fear, real harm, and real uncertainty. And that is why the words we use matter and who we include matters. Because language does not just describe reality, but it shapes who feels safe in it. So when we say community, we mean everyone. Everyone who lives here, everyone who is trying to get by here, everyone who is raising children here, everyone who is working, healing, grieving, recovering, dreaming, and hoping here. Everyone who calls Vermont home in this moment, no matter where they were born, no matter what language they speak, no matter their immigration status, no matter what their gender or identity is, or what they have been through or need to survive. Because dignity is not something you earn, and safety is not something you should have to justify. And at the same time, I also want to make space for gentleness. Because advocacy takes courage and it takes energy. Many of us are carrying stories we don't always share out loud. Some of us are here because of someone we love. Some of us are here because of what we have survived. And some of us are here because we're still in it. So please take care of yourself. Breathe deeply, hydrate, step outside if you have to, lean on one another. Because we can be honest and tender at the same time, and we can be fierce and gentle at the same time. And now, without further ado, it is truly an honor to introduce our two keynote speakers of the day. Two leaders who reflect this theme through their work, their values, and their commitment to Vermont and beyond. First, Representative Daisy Berbecco. Daisy brings a deep commitment to people-centered care with experiences spanning global health, national leadership, and community-based work in Vermont. In the Vermont General Assembly, she's focused on making mental health and substance use systems more responsive, more equitable, and more affordable. Because dignity should never depend on your zip code, your income, or your ability to hold it together. We are also honored to welcome State Treasurer Mike Pichek, a public servant shaped by a family rooted in service, including his mother's founding of St. Bridget's Soup Kitchen, which continues to serve neighbors in need today. As treasurer, Mike has focused on smart investments that lower costs, strengthen our economy, and give people across our state a fair shot at success. Because stability and opportunity are not separate from mental health, but they are mental health. So I hope all of us here today leave with full hearts and a clear call. Keep showing up, keep asking for better, and keep sharing your truth. And when the work gets hard, which we know it does, when it gets slow, frustrating, complicated, or painful, do not check out. Do not look away, but look around this room right now. You are not doing this work alone. We are not doing this work alone. Together for dignity, united for change, and absolutely determined to reclaim mental health in Vermont. So please join me in first welcoming Representative Daisy Berbecco, and then we'll have Mike, and then we will have some time for question and answers at the end.
Good morning, everybody. How are we doing? These are tough times. We're all weathering some pretty significant change in Vermont and in our nation. This is political change, and it's going to impact the way that mental health and substance use prevention and recovery happen for all of us. Just last week, we had this 24-hour period where we thought we'd lost all our funding for Project Aware and Mental Health First Aid, two things that are near and dear to me. All of us probably, hopefully. And it was restored, but I think a lot of us haven't quite maybe restored our trust in this administration's ability to protect our well-being. So we need to look to each other. That's why we're here today. We're used to fighting hard for our funding, though, and for our well-being. So this Mental Health Advocacy Day, we have a choice to embrace this change that's sweeping over us. And part of that might include not recycling some of the same terms that we use, right? Personally, I think we can do better than let's thrive, not just survive. How many times have we heard that one? Or mental health is health. Let's break the stigma. Those are, yes, all very important things. They've got us to where we are today, but I think we can do better. And I think the organizers of our event today, NAMI, Vermont Care Partners, and VAMHAR, I think they also know that advocating and raising awareness isn't the same as solving a problem. I think They know that today we have to be together for dignity and united for change, because it's time to reclaim mental health in Vermont. That's a clear call for us to work together and to make change here and define it on our terms. Our organizers today, they also know that we've been advocating for a long time. Those of us living with mental health struggles are advocating, families are advocating, providers are advocating, communities are advocating. But I think what we're really struggling with as a state and also as a society is alignment between what people experience, what our providers are asked to deliver, and what policymakers are willing to fund, regulate, and stand behind. So today I want to talk about that gap and how we close it to really reclaim mental health in our brave little state. First, I want to address my folks with lived experience. If you're someone that's had to fight to be believed or to get an appointment, to stay housed, to stay connected, or just really to stay alive, you're not the problem. Maybe you've been told to be more patient when you were in a crisis, or you were discharged too early because someone needed your bed. You might have been handed a hotline instead of real care that you deserved. Maybe you have a kiddo that's out of state because we just don't have space for them in Vermont. And I'm sorry. Maybe you've been blamed for not engaging in a system that was not built to engage you. And this isn't a personal failure. Not a personal failure. This is a system design failure. And we see the consequences of it every day. In Vermont, we consistently rank among the highest states suicide rates in the nation. We lose one Vermonter to suicide about every 3 days. And people living with mental health challenges way too often are asked or just forced to be resilient instead of us just asking our systems to be more humane and to make investments that follow those values. We ask individuals to navigate this complex system that even seasoned professionals and experts still are struggling to understand, and that's not care. So, what can you do to hold people like me, legislators, accountable? Don't let your experiences just be anecdotes. They're actionable data. And I'm not trying to depersonalize or dehumanize your experiences and the reality of them, but I just want to underscore that stories can reveal where our systems are failing, where our policies are falling short, and where lives are at risk. And that data needs to be driving our decisions and our policies, not just being listened to one day a year and then set aside. I want to talk about the family of the late Scott Garvey. Scott moved to Vermont in search of better mental health care, but shortly after, he was killed by a law enforcement officer. Scott's family refused to let their story, their tragic story, become another anecdote. So they worked, they summoned their bravery, and they worked with their legislator, Representative Michelle Boslin, to create legislation, H 613, that would expand de-escalation training for law enforcement officers and help prevent other families from enduring the horrors that they had to live through. Scott's story is full of heartbreaking data, and it informed us. And Scott's family built the relationships that led to shaping good policy that Representative Boslin and I can stand behind. I want to address our providers and frontline workers in the room, my heroes. We have a workforce crisis nationally and in Vermont. But the mental health workforce isn't shrinking just because of your burnout. You're burning out because you're being asked to accommodate policy and compliance demands that are not matched by funding increases needed to operationalize them. You're expected to deliver high-quality, integrated, trauma-informed, person-centered care in a system that underpays you, over-documents you, fragments services, and measures success in ways that do not match the clinical reality of how we're being treated. So when providers leave the field, we know it's not because you don't care anymore. We know it's because caring without support and fair compensation isn't just, and you shouldn't stand for it. We see this show up in access. In Vermont, people wait weeks to months for routine appointments and even longer for psychiatry if they can find a provider that's accepting new patients at all. So the uncomfortable truth for folks like me is that we're not going to expand access until we stabilize our workforce. So this session, I introduced H815 today. There's an information sheet on the back table where you can find a little brief on it. It's legislation that's going to stop some of the harmful reimbursement cuts to mental health and substance use providers. It's going to increase transparency when our payers and Medicaid and commercial insurance change payment policies and require them to do a real analysis of what the impact of their changes will be. I want them to know, I want them to model what their reductions in payment are going to do to service availability, to providers, sustainability, and ultimately our ability to all stay well. Because if we keep allowing payer-driven reimbursement drops and policy shifts that really drive our providers out of the system, we're not going to be able to solve this access problem. No amount of new programs, task forces, or transformation grants or technologies are going to fix this problem unless we support fair pay for our providers. So to my fellow legislators and other decision makers, so if you manage budgets, statutes, or any systems, this part's for you. Mental health isn't a niche issue, it's all of our issue. It's not just for those of us who talk about our lived experience, this is everybody's business. So whether you're ready to talk about it or not, I am willing to bet that everyone in this room has been touched by our system of care in Vermont, or tried to be touched by it. Mental health care is not an add-on policy issue after housing, education, or economic vitality. It is the engine that is driving all of those things. And we know that because if mental health care fails, we see our emergency rooms end up as psychiatric waiting rooms. We see school staff become uncompensated care providers. We see our prisons become treatment centers. We see families become case managers. And that's both more expensive and it's also more harmful. So we can't legislate our way out of underinvestment, and we can't regulate compassion into our system as much as I wish we could. And we can't keep asking our local communities to just absorb what the state refuses to address upstream in people's lives. So I think that mental health policy and funding has to move from crisis response to person-centered human design. Not easy to do. It means improving care for well-being, not just managing symptoms. It also means protecting the heart of mental health care, which is our human relationships, right? So that's why I'm introducing H816 today, which draws a really clear line that nothing, including artificial intelligence, can replace the relationships that peers that care providers or any clinical judgment can offer in mental health treatment. Technology, I definitely want it to help you with scheduling, with documentation, and creating efficiencies so you can focus on the things that you went into this field to focus on. But people deserve qualified professional treatment, not unregulated technologies. So, when I say that we have to move from crisis response to person-centered human design, I want to talk about prevention because it matters, and that's where we begin. Right now, a lot of our funding flows to emergency or crisis response, hospitalization, or high acuity care after things have fallen apart. And meanwhile, our school-based supports, our peer programs, early intervention, and family supports are often first to go when it comes to conversations in appropriations or when the governor is drafting his budget. And that is just backwards. If we're serious about reclaiming mental health in this state, I think we have to really invest upstream, and that's going to take some bravery. So I've introduced 2 bills that focus on prevention and early support in our schools. H817 strengthens mental health literacy and substance use prevention in our schools by implementing evidence-based curricula and helping students to recognize challenges and build wellness skills. And it launches a peer-to-peer mental health support pilot in secondary schools. Also, I'm introducing H818, which creates voluntary evidence-based mental health screening programs in schools. It has strong privacy protections, and also parental consent is required so that students who are struggling can be identified early and connected to supports before they come to a crisis. So both those bills are about catching problems sooner. They're about reducing stigma, and they're about building a bridge between schools and our mental health system. Because prevention is not just compassionate, it's smart policy, and it's good economics. So focusing on care for well-being means funding those upstream supports that are going to keep our kids well, not just the expensive, very expensive downstream crisis response that we've been doing for decades in Vermont. We need to start funding prevention with the same seriousness that we do crisis response and treatment. We need to start building accountability that improves care and innovation rather than punishes providers with documentation and reporting requirements. I know you're underwater. And policymakers, we need to be listening. We need to really be listening to lived experience even when it makes us uncomfortable. And I think today, in the spirit of change that we're all experiencing, I think we have to think about what we want Mental Health Advocacy Day to evolve into. Awareness could become action and greater accountability of folks like me, right? We could focus on empathy, infrastructure, and again, back to our stories, the root of all of this change. Our stories need to be translated into data that can inform change for policymakers to take forward into actionable change. So we're gonna have to ask some harder questions if we want to evolve the way that we advocate. We're gonna have to ask, why do we accept that people wait weeks or sometimes months for care, sometimes years? I mean, my kids waited over a year for a therapist. That's unacceptable. How do we maximize our peer supports? That's another hard question we're going to need to look at. Yeah. Why do we treat mental health differently than physical health in reimbursement, in access, and also in urgency? There's no way that an insurer would ever propose to reduce nurse reimbursements by 24%. Never. And I think last, we have to ask, why are families like Scott Garvey's family left to manage the system, the navigating our system on their own. We can't let folks do this anymore. So I think we have a shared responsibility to remember that people with lived experience, wherever you are on the spectrum of experiencing mental health, recognize we're not asking to be saved, and providers aren't necessarily asking to be thanked and praised, right? People are just asking for a system that works more often than it fails them. And I don't think that's unreasonable. I think we can do that. I think we have to do it by designing systems that honor dignity, that honor continuity, and that honor true person-centered care. When we do that, we don't just improve our clinical outcomes, we improve the trust that grounds us in the communities where our wellness really truly begins. So, Mental Health Advocacy Day should leave us with more than just awareness of mental health challenges and connections. Hopefully we all come here and make some beautiful connections. But I hope that it leaves us all with some resolve to embrace this change that's facing our nation and our state. I hope we can be brave and united. I hope we can honor the people who are still here despite all the gaps in our system. I hope we can respect the providers who just keep showing up. And I think we need to challenge the people with power to use it boldly, to stop being so cautious. Because the status quo is just not working. So thank you for being part of this work, and I hope you'll join me in gathering some of the information about the bills that are on the back table, because that's where we begin. Thank you.
Thank you so much, Daisy. And now we welcome State Treasurer Mike Pichek, and after we will have some time for Q&A.
Well, good morning, everybody. Thank you so much for having me as we get the microphone warmed up here.
You might just turn up that switch.
There we go. I think that works, right? Great. Thank you very much. Well, again, good morning, everybody. I'm Mike Pichek. I'm the state treasurer here in Vermont, and I just want to first start off by saying thank you to everyone who's here for two reasons. One, thank you for everything that you do back home in your professional lives to improve the communities that you live in. And thank you very much for being here in Montpelier, bringing your voices and your perspectives to as advocates to policymakers, to legislators, to all of us that are here doing work in Montpelier. You know, so often when you're here in Montpelier, you're so focused on all of the daily things that are going on in a committee or with your own bill or with your own priority. But it's when people come in from the community and talk about the challenges that you're facing every single day that it opens up our policymakers' eyes. We see the challenges that you're dealing with. We start thinking about solutions, and we start coming up with ideas and policies that address those problems. So it is really critical to be here, lending your voice and lending your perspective. You know, I just wanted to talk a little bit about, I think, the shared values that every single person in this room and I have. When I think about myself and growing up in Brattleboro, and the example that I saw in my community, the example that I saw in my parents, about how we show up for each other, about how we show up for community. You know, my dad was a small business owner in Brattleboro, and he told me, no matter what I needed to buy, that we needed to buy it in downtown Brattleboro. Every single Saturday, we had to go to the same diner at the end of Main Street, even though the food wasn't very good, and even though the silverware wasn't always clean. And I asked him, Dad, there's so many other options. Why do we have to come here every single Saturday? He said, they are my client, they help me and our family, and I'm going to show up and help them. And he did that time and time again. He helped raise money in Brattleboro so we could have lights on our football field, so we could have Friday night football games. He helped raise money so we could have a teen center in Brattleboro, so young kids had a safe place to hang out after school. He helped raise money and led a project to expand our golf course from 9 holes to 18 holes. And he doesn't play golf. I was about 15 years old and I had to ask him, Dad, you don't even play golf. Why did you spend so much time on this project? And he just, without a beat, said, Brattleboro has done so much for me. It has done so much for our family that it's the least I can do to find ways to give back. And I think that idea, that moral obligation to give back is something that everyone in this room feels. That moral obligation to give back to communities that have helped us directly or indirectly, and making sure that those communities exist, that those resources exist, to help the next generation that finds themselves with a problem that they can't solve on their own. And similarly, my mom, right before she was pregnant with me in 1982, founded a soup kitchen called St. Bridget's Kitchen that still runs to this day. She ran it for 40 years. And I would go with her when I was a little kid. She would be delivering food in the Brattleboro community to people that were elderly, that were shut in. I'd spend time with her at the kitchen when folks would enter from all walks of life, people that were struggling with mental health issues, people that had intellectual disabilities, people that were struggling with substance use disorder, people that were coming from really vulnerable places. And the thing that impressed me about my mom, and the thing that really sort of stuck with me, was no matter who walked through the door, no matter what their background was, no matter what their experience was, no matter what they were dealing with that day, without fail, every single time, she was so kind and caring and loving and compassionate and respectful. And it really instilled in me this idea, this value, that everybody matters. Everybody has value, and everybody deserves dignity. And that is what your work is about every single day. Making sure that we build a Vermont where everybody matters, that we build an economy where everybody matters, that we build a healthcare system where everybody matters. As state treasurer, I'm often working with numbers, with budgets, with investments, with returns. But the thing I always come back to is that behind every single number and behind every single investment is a person, and a person with a story. And behind every single budget is a moral decision about the state that we want to be. If we want to be a state that invests in opportunity over stigma, if we want to be a state that invests in care, then we have to be a state that invests fully and unapologetically in people who are dealing with mental health challenges, people who have intellectual disabilities, people who have substance use disorder. If we want to be that kind of state, we have to provide the resources to individuals. Because too often in our state and elsewhere across the country, folks that are dealing with those issues are viewed as burdens rather than simply as our neighbors. And the thing is, if we provide the resources, if we provide the treatment, if we provide the support and the housing, we're not just investing in those individuals, we're lifting up the entire community. And when you're investing in those people and lifting up the community, it's not just the morally right thing to do, it's not just the compassionate thing to do, but it's also the thing that makes the most economic common sense as well. And that's the kind of perspective as treasurer I try to bring to our work every day. Also, so many people get involved in our justice system here in Vermont that are dealing with a lot of the issues that I just talked about. And so often in our justice system, we fall back on sort of the old playbook of punishment rather than thinking about restoration and taking a holistic approach to getting somebody recovered and back on their feet. last month I was down in Springfield Correctional Facility, and I had the opportunity to spend a couple hours there. We have a program that we're working with a credit union to provide financial literacy and support to folks that are about to be released from prison and re-enter society. And we had an opportunity to talk to them, and the thing that really struck me, there's about 25 young people around the table, and everybody went around and sort of told their story about, sort of where they had grown up and sort of circumstances that led them to where they are. And the thing that struck me was there were 25 people that were not criminals. They were not there talking to me as a criminal. They were there talking to me as a human being that had lived experience and had challenges. And those 25 people, I could easily have 25 friends that could have ended up in that facility had they not been born into privilege of having a family that was there to be able to support them, to have a family that had the resources to be able to provide them treatment and care, a family that was there to be able to provide them the resources to get out of trouble and redirect them in certain ways. And it really left me with this idea that it's the system that unfortunately provides so many people way too many opportunities to get involved in justice and to get incarcerated in our facilities. And I think that idea about that systematic approach, those systematic issues, is really pervasive in our economy. So many people are struggling now in Vermont and across the country with issues around affordability. We are having a hard time affording insurance. We're having a hard time affording housing, having a hard time affording groceries. And all of those things impact all of our well-being and all of our mental health. It leads to anxiety, it leads to depression, it leads to despair. It makes us not only economically vulnerable, but it makes us physically vulnerable as well. And I think, again, as treasurer, that is the perspective that we need to maintain. How do we not just invest in people, which we need to do, but how do we invest in building better systems, building a better economy, building a fairer economy, building fairer communities where people are not having these opportunities to fall into despair. People are not having these opportunities to fall into our criminal justice system. People are not having these opportunities not to get treatment and to spiral into a worse situation. But they have the opportunity for hope, economic advancement, and they can see a vision for themselves that is better than the circumstances they currently have. There are a couple of programs that we have launched in the last few years that go directly at this issue. How do we build a Vermont where everybody matters? How do we build a Vermont where everybody has those kind of economic opportunities? Last year we passed a bill to eliminate $100 million in medical debt for Vermonters that are feeling the burden of those unpaid bills. It's a program that, in my opinion, is really smart. It has a big impact without a big price tag. It's able to eliminate the $100 million in medical debt with a single $1 million investment by the state of Vermont. We've entered into a contract with undue medical debt, and we're starting to negotiate, purchase, and eliminate that debt now. We also prevented medical debt from being reported on individuals' credit scores as well, because too often the burden of medical debt is not just preventing somebody from going and seeing their doctor because they feel the shame, they feel the stigma, they're worried they're going to fall into even more medical debt, but it's also holding them back economically as well. Another program that we're launching is called First Steps Forward. It's a pilot program in the Northeast Kingdom. It's going to be for residents of Caledonia, Orleans, and Essex County. And the idea is that we're going to try to disrupt poverty, disrupt economic disadvantage at the earliest age that we can. It's a 3-part pilot. It's going to have something called a baby bond for every child born into poverty. So $3,200 is going to be set aside for that child, invested by our office. It's going to grow over time. And when they become an adult, they can use that money to buy a house in Vermont, start a business in Vermont, roll it over into their retirement, or for their education or job training. It's a long-term investment in people that provides hope, provides them the opportunity to stay here in Vermont and be able to afford to do so. It's also going to be coupled with a direct cash payment for the new mothers, $500 a month for at least a year, so that there is a little bit of breathing room in the family that that child is growing up in. It's also going to provide necessities like diapers and other childhood needs. So again, that new family has a little bit of extra breathing room, a little bit of extra space to focus on the care of their family and their child, rather than the anxiety and the concern that comes with living on the edge of poverty and economic strain. And then lastly, it's going to couple together the idea of providing mental health support for every one of those mothers as well, prior to and following pregnancy. By putting these three things together, we really think we can get a program that is dynamic, investing in the here and now that a child experiences on day one, but also invests in their long-term well-being by investing directly into them with a baby bond. And the last thing I want to talk about is a program that we started 2 years ago that is now up and fully running. It's another economic empowerment program called Vermont Saves. I hope many of you have access to this program, and if you don't, talk to your employers about it if you don't have access to retirement to begin with. But it's a program that provides retirement access to individuals that don't have it currently through their employer. And all of the data shows that if you don't have access to retirement through your employer, you just don't save for retirement. And that means you're on track for a less dignified experience than when you're working. It means you're on track to live in poverty in your golden years. Vermont Saves launched last year. There's about 5,400 people that are actively saving in the program. Collectively, they've put aside $5 million for their future, for their retirement. We expect those numbers to grow exponentially over the coming months and years, so that these folks that previously were concerned and worried, and maybe they still are, but about how am I going to afford to retire, now have some empowerment. They're now building the future that they want for themselves and for their families. And the thing that's best about that 5,400 people, in my opinion, 55% of them are under the age of 40, and 30% of them are under the age of 30. So we have a lot of young people, for the first time ever, putting money aside, saving for their future, and that is really a great thing. So these kind of investments in disrupting this system of poverty, this system that traps people and really provides despair instead of hope, I think it's the #1 reason that's leading to the political challenges we're facing as well at this moment in the country. When you go to communities that feel hollowed out, they feel like the government has forgotten them, they don't think the system is working for them in any way because their life is worse than their parents' lives, and they think that their children's lives are going to be worse than their own lives. Why would they care about that system? That system is not working for them. So we need to make sure that our systems are working better for people, giving them a hand up and giving them opportunity. It will improve not only their economic well-being, but like we talked about, their physical and mental well-being as well. So in closing, I just again want to thank you all for the work that you do every day in your communities, the shared experiences, the lived experiences, the experience that you have professionally that you bring to Montpelier. It's such an important voice for us to hear in the state capitol. I hope you will continue to advocate zealously and fiercely for the issues that you care about. That is the thing that moves the needle, and it doesn't always happen all at once. It doesn't always happen in one session, but it is that persistent advocacy that does change things over time and change things for the better. So thank you so much for having me. Thank you again for being in Montpelier. I hope you all have a wonderful, wonderful day. Thank you.
Wow, that was really two powerful and impactful keynotes. We have about 5 minutes for questions from the audience for either Representative Daisy Berbecco or State Treasurer Mike Pieciak. So I'll do my best to run around if we have a second person who wants to help me. Any questions?
First off, I would like to point out that I am from Lamoille County Mental Health Services. I understand that a program known as the Wellness Center was very recently shut down due to lack of funding. I have been there 3 years, and because of this program, I am where I'm at today. And I also understand that volunteering, whether it's at a library
or a food shelf or animal shelter, that can also help with mental health.
Yeah.
So we're still adjusting to the change, but I'm just curious how you intend to hopefully deal with that. I know a friend of mine over here has a plan for that, but
I should let the money guy take this one.
you might want to stay there for a little bit. I think we have a lot of questions for the money guy.
Well, thank you for your question. I mean, the general issues that we're having in healthcare and the ability to balance the costs and the access is like one of our biggest challenges I think we're going to be facing over the next decade. You know, Vermont is one of, depending on whatever metric you look at, we're one of, if not the most expensive place to have health insurance and get health care in the country. And one of the challenges we have, you know, think about the city of Boston. The city of Boston is about the size of Vermont population-wise, but it's condensed into a city. We have that same population spread over an entire state. So we just have the simple, structural, fundamental challenge of how do we deliver health care, but do it in a way that is spread out over a large geography, and a lot of that geography is really rural places without a lot of population density. And honestly, I don't think we've found the right solution yet. There are ways that we're investing in Chittenden County that I think are exciting, particularly with the Howard Center and the Emergency Department for Mental Health, but how do we do that elsewhere? And how do we provide more resources and access in our more rural communities? And we haven't figured out we haven't figured out the right balance yet. It's a real challenge, but some of it is going to have to come with transportation, improved access in local communities, thinking the right balance of what's provided in a small town versus the larger town that's nearby, and what are those services that can be provided at an affordable rate at both locations. We have to look at it not just in Lamoille County, but in every part of the state. Where I grew up, our hospital in Brattleboro is having a lot of financial challenges. In the Northeast Kingdom, the hospitals are having a lot of financial challenges as well. A lot of it boils back beyond just our healthcare policy to what are our policies around improving our demographics, building more housing, supporting our underlying economy, because we are running into this challenge of becoming a state that is older without a lot of young people. And when you're talking about healthcare or insurance of any kind, you want to have a lot of people paying into the system and not a lot of people pulling money out of the system. Because when you have that dynamic of a lot of people paying in and a lot of people paying out, it just makes it sort of this unaffordable spiral. So it's also something that fundamentally we're going to have to address over the next decade as well, if we're going to have the resources to be able to make sure we have access in our rural communities too.
Can you hear me? Okay. So I had a question for you and a question for you, if that's okay. So I was wondering, you talked about the moms and the mental health support and the money that moms would get and the money that would be put away for the child. What if that child is residing with a father? Can that father get those same supports because they don't have a mom in the family? I somehow didn't speak into it, by the way. I'm sorry. You can restate the question.
Yeah, so the question was, what about if there's a child that is living with a father and not with a mother? Will the father get the same kind of support if they're a single father? And it's a great question, and my answer off the top of my head is yes, because we're going to now make that the case. So I really appreciate it.
You were forced into that.
No, I wouldn't view it that way. I would say it was a great perspective and one we hadn't considered, and now we will, and that makes total sense.
Yeah, I think it's important.
Yeah.
My quick question for you was, my friend Kim here was, do you want me to sing? You don't want me to sing. My friend Kim here was addressing Lamoille County Mental Health. They shut down the peer program, so there was 12 of us laid off. And part of it had to do with going to Case Rate a few years ago and not being able to bill for peers. But you're talking about more investment in peers, so that really excited me, and I like what you had to say. We were a little late, so we missed the beginning, but I would love to talk to you at some point about that, because we are trying to organize to find our own wellness center outside and figure out how to get a grant and all that stuff, which I've never done before, but apparently I'm about to learn. So when you talked about expanding peer services, and you also spoke about working in the Northeast Kingdom, I worked at the Northeast Kingdom Human Services as a CRT case manager years ago. I think it's important when Wales and feel like, not that you forget us, but we're like not the most exciting county. So you know that. So I just would like to hear more about when you said at the podium, more investment in peers. What specifically, could you give me like 2 things so I don't want to take up too much time?
So I would like about peers much longer, but I think the first thing that I'm most excited about is when was it? Emily, 2 years ago, we passed the peer certification bill, so folks can start billing Medicaid to be reimbursed for peers. Yeah, so they can, but there are still folks that are getting trained and delivering peer services like they have been for a long time. We're still honoring and protecting those services because we know that when our designated agencies or even private providers do that people get better faster. Yeah, and so when I'm excited about, or what I'm most excited about is that it seems all of our designated agencies are going for CCBHC certification. Yes. And a requirement of becoming certified as a CCBHC is that you have to provide peer services, because it's so widely recognized now, thank God, that our model way of delivering services for mental health and substance use include peer services. So, yeah, and the state's supporting that. Obviously, our legislature is supporting that too. So I think that's probably the most exciting one, and also, continuing to have peers available at every level of care is a priority.
So much appreciated. Yes, we're trying to do that, CCBHC. And the last thing I want to say is we have 2 residences. We have a group home, and then we have Copley House, which is unique. I'm on that board, and I'm very concerned about the state pushing people to be rehabilitated. Some of these folks are getting worse, not better, and they would be in a nursing home next to someone dying when they don't have to be. So if you could look out for those folks too, and I think they would love peer services.
Yeah.
Thank you. I am already over time. I'm the first person to put in this segment because I want to hear from everyone. But we do need to stop the Q&A in this moment because we have a really important sharing stories segment coming up to hear from people with lived experience. But that being said, we all want to hear from all of you. So we are super accessible in this room, as we've heard from Amy and also Daisy. Our representatives want to hear from us, right? So we really encourage you to keep speaking to us, to keep speaking to our reps. And yes.
I really do want to hear these 2 questions. And so my contact info is on my handout. It's blue and white at the back of the room. It has my 4 bills on it. And my email for anybody that's ready. Go to my website, daisyforwanewski.com. Okay? daisyforwanewski.com.
Nice.
You want to give your contact info?
I don't even know my contact info,
Like
but certainly it's available through our website, the Treasurer's Office, so please feel free to reach out.
Amy.
Wow, we might be outgrowing this space. Thank you, each and every one of you, for being here. My name is Amy Rose, and I am the State Policy Manager with Vermont Care Partners, and I am honored to introduce the storytelling portion of the day. Storytelling is a powerful and favorite part of Mental Health Advocacy Day. It is also a fundamental part of being human. Sharing a personal experience creates connection among people and between people and ideas. When we share our narrative with others, we create an invitation into our truth. When we tell our stories in a setting like this, we create community. Stories remind us that we are not alone in our struggles. Listening to a story is also a powerful act that fosters empathy, builds community, and promotes learning through shared understanding. Some stories may be difficult to hear, and we invite everyone to practice good self-care. If you are here in the room, we have a support person. Megan Blanche, do you want to raise your hand? And great. Who is available to you. If you are joining us virtually, you can access support by calling 988. If you choose to share your story, we ask that you limit yourself to 5 minutes to create space for others to participate. Several people have signed up to share. If there's extra time, we will invite additional participation. I'd like to first invite up Jody Gerard.
Good morning. My name is Jody Gerard, and I have lived with severe mental health since I was a child, and I have been hospitalized here in Vermont over 40 times. So I have a little bit of knowledge about the system, a little bit. And Martin Luther King Jr. said, "But I know somehow only when it is dark enough can you see the stars." I've had a lot of darkness, but because of all that hardship, I've embraced a lot of the lightness that I found in peace and others who are struggling. I guess my biggest thing that I would like to say is turning to the person next to you and listening, hearing them, being seen and heard has been the greatest gift that I have been given. Emily Dickinson talks about hope, and I believe there is always hope for people who struggle with mental health symptoms. She says, "Hope is the thing with feathers that perches on the soul, that keeps the tune going and never stops at all." I believe so much. I have lost hope a lot, but I keep coming back to it. People keep giving me hope and reason to keep reaching out and helping others. I have worked my way up to working part-time for NAMI, Vermont, and thanks. I train others to share their story. Now there's a thing that's around called MAID, which is Mutual Aid in Dying. And I have had conversations with people who have said, maybe this should be something for people with mental health. And I don't know how to say the word vehemently very well, so I'm gonna say strongly. I strongly do not agree. I believe that we all have a sense of purpose of just being. So I want to change that acronym of MAID to MABE, Mutual Aid in Being. We all need that dignity. We all need it. Everyone sitting here needs to be seen and heard and validated. And I spent a lot of time in hospitals, and one of the greatest gifts that I could give was giving someone a poem that sees something about them that is beautiful beyond all the mental health struggles. In fact, when I was trying to get back into working, I worked at Home Goods, and some of you have heard this story. It's really fun to work in retail during the holidays. And I was there, and I had a name tag, and this woman came up to me and said, "Jody." And I went, and she's like, "Oh, it's so good to see you. We were in the hospital together years ago." And I'm going, I've been 40 times in the hospital, you know. And She opened her purse and she pulled out a poem that I had written her in one of those days. I didn't remember her, but she was seen and heard, and that she felt that. I know that there are a lot of people who are survivors of suicide, and I've had a lot of friends and family who have had to mourn and find some kind of peace. So I'm going to close with a poem that I wrote. I just have to see if I can get to it. Let me just be really quick because I only have a couple minutes left. And I need my glasses because I can't see. It's called Peaceful Land. And I've given it to several people to try to address the pain and that people who are still here have with their loved one. So it goes like this. I'm staring out the window, drinking cup in hand, wondering where you've gone to. Are you in a peaceful land? My days seem so longer as I wander about the place, cleaning up while thinking of your dear sweet face. Oh, little one, my dear child, I wish that I could find. Oh, why have you decided to leave this world behind? I'm waiting for an answer that I will never get. It's hard to do much now. I just cannot forget. So I sit here drinking coffee, looking out at the view of fields with dandelions, but seeing only you. Oh, little one, dear child, I wish that I could find. Why have you decided to leave this world beyond? How do I keep on going, doing normal every day? How do I fill the time up to ease my pain away? I want to know the reason you felt so all alone. Why didn't you reach out to me? Now I sit here by the phone. It doesn't ring from you, dear, it rings with another voice. I dream of hearing you, but that's no more my own choice. Little one, my dear child, I wish that I could find. Why have you decided to leave this world behind? People say be strong now, to live each day today, to keep myself so busy and not sleep the day away. But I'm tired. And I'm angry at what you've done to you. It comes out in my tears, obstructing my own view. I wish that I could fill up and do what I used to do. Time is my own courage, the one thing that will be. As the days turn to weeks and months, I need to set me free, to tell myself it's okay to have an aching heart. It's sometimes like telling my mind to forget you, let you part. But oh, my little one, my dear child, I wish that I could find. Why have you decided to leave this world behind? I walk out to the flowers in the fields where you once ran, and I walk on just for hours, just as long as I can. My legs start their aching, and I have to stop and rest. I take in a deep breath and start to feel the test. Are you with our God, not wanting me in pain? I reach out my arms wide and I feel you through the rain. I stand out there just pouring my heart to your stretched hand. Oh, perhaps now, my dear child, you are in a peaceful land. Thank you.
Thank you, Jody. Next, we have Bill Coleman. Is Bill here? Wonderful. Thank you.
Some of this will be personal, and some of it will be more oriented towards just general experiences I've had with working in the field of mental health for quite a few years. So I'm not sure if I'm speaking to you as a person in recovery or as someone who's a caregiver, or combination, I guess, of all sorts of different roles that I've played. But it seems that awareness of the frequency of suffering associated with mental health challenges is nowhere near what it ought to be. All too commonly, Vermonters quietly sit at home and won't reach out for help while going through one horrible day after another with some extremely intense symptoms. For years, I was one of those people. Because people who are mentally ill usually do not live in complete isolation, we impact the lives of those around us, sometimes subtly, but other times in shocking and profound ways. It's not unusual for someone who is going through what can feel like a living hell to say nothing even to those who may be around them. Many people grow up believing that people should be able to solve their own problems and be self-sufficient when it comes to trying to work through the most difficult of times. Often people who are severely depressed or even feeling suicidal will internalize all of the horrors that they are feeling, even to the point of concealing any thoughts about a suicide plan entirely, or making only the vaguest of hints. Most people are highly uncomfortable with the idea of raising the subject of questioning a family member, a friend, or a community member to the effect of asking whether they'd be considering ending their own life. There are best practices as far as asking such highly sensitive questions, as well as approaches to avoid. And I was glad to have learned of these through several different offerings that I've come across over the years. Therapists and individuals specially trained in suicide prevention and allied mental health organizations stand ready to respond to opportunities to intervene and work with people who are at risk of making rash decisions about ending their lives. However, stigmas about mental health and suicide very often drive people to keep their suicide plans among their most closely guarded secrets. This can set the stage for some extremely sad endings to lives that could have, with the proper interventions, it might well have been turned around towards much happier days ahead. I'm a person experiencing decades of continuous recovery now from extreme substance misuse of alcohol and other drugs, followed by working, as I said, with my career in various mental health settings. My life has been personally marked by closeness to many a dear loved one, friend, or community member whose lives came to sudden and very sad endings. I wonder about others who overdosed and whether there was any deliberate effort to have done so. We'll never know. But statistics indicate that people suffering from the full range of mental health conditions should be regarded as vulnerable. Of course we are. We are more often victims of violent actions by unhealthy opportunists than perpetrators of acts of violence that we initiate ourselves. However, a certain small percentage of people with suicidal ideation can also have homicidal tendencies. Once a person is not well to begin with and ceases to care about her or his own life, it is not an enormous extension to begin thinking about harming certain individuals so they feel have wronged them. Some develop plans not just to end their own lives, but to make one final statement and take others along with them. To me, mass murderers who decide to kill as many people as possible have simply decided that they have been wronged by society in general, or that they feel that people themselves are the problem, no matter who they are or whether they have ever had any relationship with them or not. This is, of course, an absolute worst-case scenario for collapses of mental health, one that I believe tends to take place in almost complete isolation from interaction with others. The greatest diagnostic work that science can offer has no effect on preventing mass tragedies when a person never comes forward for help and simply bottles up anger and aggression to the point of suddenly surfacing with a military-style assault weapon to commit a final act of rage. It's long past time to stop placing the blame for high-profile mental health crises that result in mass casualties at the feet of the mental health system itself. The mental health system can only be so good as the extent to which people decide to make use of it. That is why it's so important to work towards eliminating stigmas about mental illness. Supporting parity between mental health care funding and trauma care has gone a long way towards increasing public utilization of available treatment options, but there's so much further to go. Even when there's a lag between a mental health service being introduced and when it finally reaches fuller utilization among the public, The sheer visibility of enhanced service availability can support improved public awareness that mental health crises are a normal part of life for many of us. Anyone could unexpectedly slip into a wide range of mental illnesses. This is just one reason why organizations like the one that I belong to, which is the National Alliance for the Mentally Ill, or NAMI, are playing such a critical role in enhancing public understanding of mental illness through educational offerings, support groups, and literature. In my case, I'm active in the Northeast Kingdom chapter of NAMI, and we're proud to be offering a new support group in Newport at a great new critical care facility there called the Front Porch. Our support meetings take place there, incidentally, every Tuesday afternoon from 3 until 4:30 p.m. If you know anyone out in that area might be interested. Anything we do which results in reducing the stigmas associated with mental illness hopefully serves to make it possible for more people to feel free to reach out for help rather than internalizing their suffering. Talking to whoever a person in crisis may feel comfortable with about a vexing and deeply personal mental health situation may open the doors to whatever relief may soon be accessed by the sufferer. Whether the problem a person is facing is rooted in depression, schizophrenia, addiction, or whatever else it may be, support for mental health offerings has a multiplier effect. This can ease or prevent suffering, not just for the person experiencing the crisis, but for a great many people who they may be in contact with. My life has brightened so dramatically since I began working on my recovery from substance misuse. Once successfully activating my substance misuse recovery, I have become able to address some very serious underlying conditions. In my case, this was underlying trauma that began earlier in my life and had been surfacing through my self-medication with alcohol and a sick variety of other substances. I wish so much that everyone could experience the side of life that exists when effective combinations of treatments are found and taken to heart by each person who suffers from mental illness.
Thank you, Bill. Next, I'd like to invite up Judy Seiler.
Hi, everyone. It's great to see so many people here today. I'm telling a story about my daughter. Although I have experienced, I used to have seasonal affective disorder and some depression, and so I can totally relate to the peers in the community too. We adopted our daughter from Russia. They had shown us a video of this 2.5 happy little toddler. When I went to Russia, size of a 6-month-old baby. She'd been thrown in a crib and pretty much neglected. And so we brought home this little sweetheart. And she was so brilliant and so amazing. She just was catching up so fast. I got her, and now I know how incredible this is because it's evidence-based that getting within 8 feet of a horse improves your health. One of the first things I did was get her on horses because I had ridden years ago. And so we did horses, we did figure skating, we did skiing. She wound up becoming an outstanding figure skater, qualified with 4 Olympic trainers to go to train for the Olympics. But we decided that would be a little too stressful because with her attachment disorder, her ADHD, anxiety, multiple things that she'd already experienced. We just, if anybody sees TV or sees anything and you hear some stories, the ice skating people can be pretty tough. We were at a competition in Massachusetts, and she was making friends with another adorable little adopted girl, and the other girl's coach goes, you can't be friends with her. We compete against her. You can't like her. And so, we said, oh, this is not the right thing. So we switched to gymnastics. And the thing about Lisa is a couple hours of skating, a couple hours of gymnastics. Even though she's a little bit on the spectrum and different things, she could interact with people. She could do her homework. Just totally amazing. And so then we went on, and we've been on a roller coaster. There's been some tough, little episodes, tough breaks, but we did get all the way up to high school, and She became, in high school, as you know, the things can develop at that age. She was at the high school and became manic and was running around the school going, "Catch me if you can." And, so we had some, trying to get her help. And, unfortunately, my husband had a heart episode. We were at BMH at the Brattleboro Memorial Hospital, and we were there for a rehab thing for his heart. And a loudspeaker came on. "Hey, you've got to come up to the ER. There's our daughter was there." And we went up, and she's so smart. She had figured out the combination to the lockbox for her meds, had taken everything in there. She'd gone outside. Very fortunately, our next door neighbor, who was a retired state policeman, he fell into his arms, and he got her to the ER. And we're so grateful that she was rescued, and she went to the retreat. And all these years of, our roller coaster, and nobody had ever mentioned anything like NAMI. What's that? And so she was at the retreat, and they said, "Oh, there's a support group in Brattleboro. Why don't you go?" Went to the support group, and they said, "Oh, there's this thing called Family to Family, this class." Oh, so I took that. Michelle Boslin, back then, was a facilitator. She and her husband were the facilitators, and it was like, whoa! I wish I had known all of this sooner. This is just totally amazing, and I immediately took the training to become a facilitator myself. So Lee, but before I got to that point, Lise was at the hospital, and they said, "Oh, she's ready to go home," and we're like, we don't know that we can keep her safe. So what literally we believe saved her life is we were very fortunate she got into the Hilltop program that HCRS has, a residential program for young adults, and it was just a lifesaver. It was just the most wonderful thing. I cannot, tell HCRS, I've many times told them, that we just can be more grateful, and I wish we had more programs like that. And she was able to go straight from there to college. And once again, we've had roller coasters, we've had some tough years. But to give everyone hope, even with the roller coasters and things that have happened, she is almost done her master's degree in clinical psychology. So, as I've said, never give up hope.
Thank you, Judy. Next, I'd like to invite Matina up to share a story written by Tyler Sears.
I think I'm going to try to use this microphone because I think I'm a heavy breather and a loudspeaker, so this one was not doing so well for me earlier. Also, just kidding, you thought you'd hear a lot from Amy, but apparently I get to talk a lot. I have the privilege and honor to share a story by Tyler Sears. I don't take this lightly. Tyler is not able to be here today with us, and I am really grateful that he's trusting me to share his words with all of you. My name is Tyler Sears, and I'm 35. I'm a 35-year-old drug addict in recovery. I was born to a 13-year-old mother and a 19-year-old father in September of 1990. That sentence alone tells you most of what you need to know about how my life started. Unstable, unsafe, and already carrying more weight than a child should. By the time I was 6 years old, I showed up to school with a serious head injury. I would not explain it. I wouldn't say who it did. I knew even then that telling the truth could cost me the one connection I had left. That was the day the state took me. One moment, I was someone's kid. The next, I was a case file. I grew up in institutions and foster homes, places with rules, routines, locked doors, and clipboards. I learned early how to survive inside systems, how to stay small enough not to get noticed, how to follow rules just enough to stay out of trouble. What I did not learn is how to feel safe. People think addiction starts with drugs. Mine started with survival. Both my parents struggled with addiction and mental illness. Add trauma, ADHD, anxiety, and instability, and the odds were not great. But the real damage wasn't just genetics. It was that my nervous system learned early: stay alert, stay guarded, do not relax. Chaos felt normal. Quiet felt dangerous. When I finally found relief, it did not come from a substance at first. It came from structure. Institutions made sense to me. Clear rules, clear consequences, no guessing. Freedom, on the other hand, overwhelmed me. Too many choices, too much responsibility, too much room to fail. So when drugs entered my life, they didn't feel reckless. They felt safe. They quieted my mind. They slowed my body down. For the first time, I was not bracing for impact. Substances didn't feel like an escape. They felt like regulation. They did what no system ever taught me how to do: calm myself. And once I learned that shortcut, I chased it. What followed were years of addiction, incarceration, probation, and relapse. I moved between jails, halfway houses, rehabs, and the streets. Vermont spent a lot of time locking me up for behaviors rooted in untreated trauma and addiction. Every time I got out, I was further behind. No stability, no safety, and no real treatment. Prison did not fix me. It only reinstated the belief that I am not worth fixing, that my life was worthless, and that I should give up. It reinforced what I already believed, that I was meant to be managed, not trusted. I knew I had a serious addiction when I spent a good portion of this past summer overdosed on the streets of Burlington, with no direction and without a care in the world. I overdosed 5 times that past summer, but gracefully God held on to me. I knew it wasn't by chance or coincidence. The closest I came to dying was an overdose alone in a Phoenix bathroom in 2016. Phoenix house bathroom, sorry. 6 hours unconscious. When I woke up in the hospital, handcuffed to my bed, my first thought was not gratitude. It was panic about the drugs being gone. That's how sick I was. I should be dead. There is no dramatic explanation for why I am not. I did not make better choices. I didn't stop in time. I survived because something kept interrupting the ending. And eventually, that forced me to ask a harder question. What if addiction is not a moral failure, but a nervous system doing the best it can with what it was given? What if locking people up does not create safety, but reinforces the very patterns that keep addiction alive? I was locked up in October, segregated for almost a month before being brought to Bradford's Valley Vista for 30 days. This life-changing experience around some of the world's best staff and recovery aides blossomed into an opportunity to take my life back and live without substances. I graduated from Valley Vista and went on to the Regents location, a 3.1 program, a residential treatment program where recovering addicts can be housed upwards of 90 days while being reintegrated into the community. Today I am sober, not because prison worked, but because I finally learned how to regulate, how to stay present, how to build internal structures instead of relying on external control. I allowed for a hard reset of my beliefs and understanding and became teachable for Valley Vista to do their work within my life. Treatment worked, understanding worked, compassion worked. I stayed alive long enough to learn that. I used my time in recovery with Valley Vista to write a book, but I stayed. A memoir on substance use, institutions, and God. I decided to use the fact that I was always good at writing and memory to my advantage to spread the truth that there is another way out besides the jails, institutions, and death. And that's recovery. And that's why I'm here, because recovery does not start with punishment. It starts with stability, treatment, and the belief that people are worth saving before they are broken beyond repair. I stopped running from the fact that I have an addiction and stuck through treatment. I stayed. Again, this is Taylor Sears' story.
Thank you. And we have a number of other beautiful submissions, and we will find a way to get them out to you. But we have to switch our gears and move to another celebrated part of the day. I'd like to invite Daniel up to begin our award ceremony.
So to present our Lifetime Achievement Award, I would like to invite Phil Blackburn to come up and read a citation.
Thank you very much. It's excuse me. It's very nice to be here to represent HCRS. I've been on that board for quite some time, and they had the misjudgment to make me chair of the board for like 3 years, but they're still here, so we're good. Today we have the opportunity to recognize someone whose work embodies the values of the folks who are here and are in the business of treating folks with mental health disorders. This award is not just about years of service, although the recipient has quite a few, but he also has had a lasting impact both within HCRS and within the community in which he lives. We live in the same community. I know very well what he does within that community. And over more than 30 years with HCRS. In those years, a lot of challenges were presented, not the least of which was COVID, changes in payment systems, something that the DAs out there are very, very familiar with, and budgets, both ample and challenged. And it's been as you know, with budgets, it's you're always waiting till kind of the last minute to hear what your budget's going to be, and then you go from there. Collaboration has been a hallmark, I think, of who I'm talking about, be it Vermont Care Partners, Dale, Department of Mental Health, or local selectmen in the communities in which HCRS administers help, both Windham and Windsor counties. And Advocacy has never been separate from his leadership. He also has always just meeting in and meeting out, and I've been in more meetings than I can count with this gentleman, he always talks about philosophy of care, which kind of really does symbolize what he brings into a room, compassionate, caring attitude for those who are in need. He is also deeply humble, which is something that I think is difficult because he's a man of really, in my judgment, great accomplishments, but his humility has at times just really touched the board members, touched the staff, and more importantly, touched the folks that receive the services. So what I'd like to do is, speaking for the HCRS board and myself, particularly the employees, past and present, I would like to award the Lifetime Achievement Award to George Karabakakis. Come on up.
Okay. Am I like, I don't know, is this thing on? Am I supposed to say something, or I don't even know where to begin. You know, I got this, this was really weird. So I'm walking out, I had a legislator that said 10:45. This is the only time we can meet. So someone sent Ann Bilodeau with me to make sure I come back. I was like, what? This is where, anyway. I don't know where to begin. I want to thank certainly Phil, our board, our team. I mean, this is not, I don't know. This is not real. This is not about, this is really an award and an acknowledgement that really needs to be shared with our team, with our staff, with the people we serve. I remember when I first started this work, it was like, just about 32 years ago, we had a small clubhouse in Brattleboro, and Mary Ellen Copeland would come over pre-wrap, and I tell you, I have come to this work with my own lived experience and that of my family, and this is just incredible work. The commitment, the dedication, the passion, the fact that we are able to share in each other's humanity, knowing that we are in this together. Whatever happens with policies and what might be happening around the world and around our country, we are in this together. And so many speakers said it so beautifully and so articulately. And I just want to resonate, it so resonates, and you all are doing, we are all doing incredible work, and I just want to thank you all for this recognition. I think, is that like, what is it, imposter? Like, do I really deserve this? I don't, it's not me. It's really, anyway, I know there's other awards. I just want to, because I do tend to go on. So thank you. Thank you very much. Oh, yeah, okay, so. Oh.
For the second one, I'm going to read the nomination, and this is for the 2026 Mental Health Advocacy Award Excellence in Leadership Award, nominated by the Belkate School. The citation is, in recognition of exemplary leadership in building a team-based, family-centered medical home model that improves access to integrated mental health and home-based supports. Belkate School nominates Dr. Steve Hale for the 2025 Excellence in Leadership Award. In our experience, mental health services can be very difficult to access and secure in Vermont. Dr. Hale has played an important leadership role at Essex Pediatrics to develop a medical home model that operationalizes team-based, family-centered, culturally respectful care, integrated mental health, and home-based supports. He has developed a team of professionals and culture that plays a leadership role in Vermont's pediatric mental health landscape. Together, they've built a dedicated mental health team, created the Strengthening Families Initiative nonprofit, and host community-facing support groups and services that go far beyond typical primary care. Dr. Hale has always been an accessible community partner and is known for always taking a call to problem solve with any team or family that is requesting support or consultation. The Excellence in Leadership Award for Dr. Steve Hale.
So I love Jesse Bell from Belkate School, if you know Jesse, but sometimes he doesn't give all the information. So he said he can't come today because they have a thing called school today, okay? So I'm Jeff Springer. I've been friends with Steve for about 25 years. And Jesse sent out to us and sent it to me and a few others, said, hey, can you ask people to vote for Steve? And I said, yes. So I sent to a ton of people, and the responses varied from their friends, former Belkate students, colleagues, parents. There's no one better. Well-deserved, a leader, a man of principle, lives his faith out in helping others, helps my kids. I'm so thankful for Steve and what he's done. He's caring, he's humble, and he's humble. So I two specific ones I want to say. One is Marley, who I deal with my job as a social worker at Essex Pediatrics. And her comment was, Jeff, Jesse sent me the same message. I asked him, did you tell Steve you nominated him for this? Because he won't tell us. He won't let us vote for him or anything. The second one was his son, Josh, his youngest son, Josh, said, thanks, Jeff, for passing this along. He may never have told us. I know he's been working hard to get all kids the help that they need. So then I thought, for me, as a person who's known Steve for a long time, what would I say? And I put down this: he's the most selfless person I would say I know in my life. He's a man of character. His faith impacts his daily decisions to care for others. He's a person of action, not just words. He's always available. He collaborates. He doesn't see barriers that get in the way. He sees what can we do to make a solution. And I would add, he's humble. So I'll end with this. I moved to Vermont in 1999 with my wife and kids. A work friend said, there's this guy named Steve Hale. And I'm like, as a Maryland basketball fan, I knew exactly who Steve was. A mom from Asheville, North Carolina, knew exactly who Steve was. But that's who he was. It's not who he is. Well, cheer up, say this. Steve has moved to Vermont to be a doctor, not a basketball player. And I stand here on the behalf of families, friends, Belkate students, people you have helped, to say that in honor, that he made Vermont home. He made Vermont home to help other people and has done that for 25 to 30 years. So I get the honor of presenting this on behalf of Belkate School, on behalf of NAMI, who does fantastic work, and on behalf of families and friends. So thanks, Steve.
Thank you for the award. I'm a part of a team, and Kath Burns runs our mental health team. She's exceptional. If you want to know what we do, call Kath or call me, and we'd be happy to tell you. Thank you.
For our third award, I'd like to bring up for the Advocate of the Year award, Alicia Post.
It's not an award for me, it's for Mark. I'm going to tell you about Mark. So my name's Alicia Post. I work for Washington County Mental Health Services. Woot woot. I see you all in the back. And it's an honor and a privilege to present this year's Advocate of the Year award to our very own Mark Schmall. Mark has been a pioneer in leadership, clinical excellence, advocacy, and compassion at Washington County Mental Health Services for more than 40 years. He's both a fierce and deeply kind advocate for all people, especially for Vermont's aging population. Mark began his career in our CSP-CRT program at its very inception and has led the way for countless others on a path toward recovery. He currently serves as the Director of Counseling Services in the Intensive Adult Mental Health Program and is the Program Manager for our Elder Care Services within Adult Mental Health. In these roles, Mark has built strong, lasting partnerships both within Washington County Mental Health Services and with external organizations, including the Central Vermont Council on Aging, among many others. Mark was part of the very first pilot program of the Elder Care Program and went on to grow it to be one of the most robust and respected programs in the state. His advocacy for Vermont's aging population is tireless and far-reaching, including presenting to state legislature on numerous occasions to ensure their voices are heard and their needs addressed. I've never met a more kind, caring, and genuinely good human being. Mark's dedication to the people we serve, the staff he supervises, and the broader mental health community is beyond what words can fully express. His impact, both professionally and personally, will be felt for generations to come.
Well, I have to say thank you so much for this recognition. I have to say that the last couple of weeks since I learned of Alicia's very kind nomination for this, I've been a bit overwhelmed and extremely humbled by this. I want to thank everyone that invested a vote in me. Thank you so much. I appreciate that. But as has been shared by some other folks already up here, I'm standing here a bit nervous. I see my name on this award, but I can, in truthfulness, say that I feel more of a representative getting this award than something that's just aimed for me. Oh, I have to think back, I'll be brief, but my earliest childhood memories are of spending time and hanging out with my father, who passed this last July at the age of 94. He was a minister working in the inner cities of Philadelphia, working with gangs and in the inner city housing projects, and I followed him around a great deal in my younger years, and he taught me a couple of really key lessons that I have carried with me. The importance of faith as a motivating factor in what we do, and to reach out with kindness and compassion to everyone and to live by the golden rule, to do unto others as you would have them do unto you. And then I look back and I see so many faces over the last 40 years at Washington County Mental Health. My coworkers, my colleagues, my supervisors, my mentors there, the folks that I have just found such joy in supervising in a few of the teams that I've worked with over the years. Each one of these in some way taught me what it was to be an advocate. They helped me to learn, I think, the head knowledge, but more importantly, the heart knowledge of this important mission of community mental health that we do. And then I am eternally indebted to a remarkable group of clients that I have had the honor and the privilege to work with over those 40 years as well. They've taught me everything I know about self-advocacy through their resilience, their perseverance, their grit, sometimes grit over what seem like insurmountable odds, and life situations that I don't think I'd be around to tell the tale if I had experienced those. So I know that all of these folks have been a combination in my life that has defined my values, my convictions, those things that are worth fighting for and standing up for, not because they're easy, but because they're the right thing to do. And so I just want to thank you again. There are many folks that stand up here with me, and I know that, and I have to give due recognition to that. I wouldn't be here without them, and I thank them. But I thank all of you for this recognition. Bless you all. Thank you.
So you all have been just incredible, patient, and everything. We are nearing the end of the program. In case you're wondering how the heck we're going to feed this many people, we were wondering that too. So we ordered some more food. We're going to have a Vermont smorgasbord. In case you don't like pizza, you can blame me. So we did order a bunch of pizzas on top of everything that is there. I'm actually going to I'm going to deputize all of you to kind of help us to make the tables and surround them with chairs for our lunch with legislators. And before we move to that, we've got a little surprise, and then Lori's going to wrap us up. But I feel overwhelmed, honestly, looking out at this crowd with emotion and hope and gratitude and amazement at what I see in front of me. And I also think about the fact that many of us are here because we have experienced adversity, because we have maybe overcome adversity, because we are living through adversity, and we've turned into a way to pay it forward and help others. And at the same time, many of us have experienced profound loss, both in our lives and in our careers. And I hope that I'll be forgiven for doing this, but I just want to mark the fact that Scott Garvey's family is here. And I don't know if you'd be willing to stand up for us and just to wrap our arms around you and to say that we're with you, and you are not alone, and all of us who have lost continue this fight for you and your family and for all of our families and for all of the people that we have lost. To turn that into action, it's incredibly brave and incredibly strong, and I honestly believe all of you are those things, incredibly brave and incredibly strong, and your vote and your voice matters today. There are people elected in the state of Vermont by a margin of 1 or 2 votes. Every voice in this state matters. Every neighbor is our neighbor. We are not 6 degrees of separation. We are 1 or 2 degrees of separation. We are each other's neighbors. There is no separation. This affects us all. So I just, please look around you and realize that, these are your allies, these are your colleagues, these are your friends, these are people like you, and that your stories and your voices have power to change things. So to share our surprise, I would like to invite Judy Seiler, who is representing the CHIP and Judy Seiler are the chair and co-chair or vice chair of NAMI Vermont, but really this is on behalf of us all, because every once in a while there are these singular figures in our community who deserve to be acknowledged. So, Judy.
It's my pleasure, on behalf of the staff, board, and all the volunteers of NAMI Vermont, as well as all of those involved in our wider mental health community here today, to present this Lifetime Achievement Award to Lori Emerson. Lori, you have worked tirelessly for many years at NAMI Vermont to make sure the community we serve receives excellent support and services. In 2011, you joined NAMI as the program director, and a couple years later, you took the reins as the executive director, a position you have held until this year. You have announced that you will be retiring a little later this year, and I can't think of anyone more deserving of that reward of retiring, although I'm very upset. But before we all let you go, I thought it important to recognize some of your contributions. Prior to joining NAMI Vermont, you worked for about 15 years with the Vermont Council for Quality, as well as the National Council for Performance Excellence. Quality and performance excellence, two characteristics that you have lived by ever since and that you applied throughout your career. Upon joining NAMI Vermont, you began building bridges to other organizations, making connections which were instrumental in bringing together all of the various advocacy groups in the state. And you did this as a kind and considerate leader, bringing your own empathy and compassion to your work. And even as you grew NAMI into the organization it is today, you brought that compassion and friendship to all of us and to many, many more people that aren't here today. I never would have had the courage to become an advocate and teach classes and do the things I do if it wasn't for you, Lori. So as I look around the Capitol today, I see the result of all of your hard work. Advocacy Day in Montpelier has become an annual event, bringing together hundreds of participants, co-sponsors, and voices. You've been instrumental in growing this group over the last 11 years to what it is today. You've given us a forum to collectively address our state lawmakers, to make them understand what the mental health needs of Vermont are. One voice raised to achieve common goals. And as I said, you've inspired just so many of us. We thank you for all you've done and wish you well upon your retirement, and you are going to be sorely missed.
Thank you so much. It is quite an honor. It's just an honor to be here today with all of you. I mean, this is how we've grown Mental Health Advocacy Day. We started out with maybe 25 people at the State House, my first Advocacy Day, #1. And look at how we've grown. We've got hundreds of people. I remember working with Peter Espenshade to say, you know what, we can't do this alone. We need to do it together. And that's why bringing all of these co-sponsors and their network here, this is how we get it done. It's by our lived experience that legislators want to hear from us. And I was never an advocate before this, except for my son. I have 2 sons, and they both have depression and anxiety. And there's always that hope. There's always that recovery that people go through. And because of what they went through when they were children, it changed my life. Because I dedicated my life to coming to NAMI Vermont, where this is family. You can say things to people at NAMI Vermont from your heart and not be judged. We stand up for each other. We care about each other. And I can remember getting phone calls from people, and when I first started working here, and I said, wow, I can use my lived experience to help other people. I'm not a clinician, but I've learned from all of you. You've helped to inspire me, and the experiences you have, I bring to the State House. I let them know what we need to change, and we need to keep changing things. My family's been through some horrific things as well. You know, crisis response shouldn't be police coming to your house when there's a mental health crisis and tasering your loved one in front of you. And I testify to this. And we need to keep letting people know what we need to do. But I just want to thank you so much for this recognition. There's a new job opening up at NAMI Vermont.